So, first question that was a common theme was, how is risk managed? Who is liable and what are the insurance implications? Sort of got two people who I think will be able to help answer this. Paul and Richard are at the end of the table. So perhaps if you can briefly help to answer this particular question between you.
Okay. Will I start? Yeah, sure. People might let us know if they can't hear us down the back or whatever. Is that okay? Yeah. I suppose, how are we managing risk? That was a significant issue in respect of the project, and particularly as we were planning the pilots. It might be a point of frustration for some of the pilots as well, in terms of there was quite a bit to do in actually how we thought through what we were approaching. I touched on that this morning in terms of the whole risk profile of the piloting bit, and it covered everything from how we went to recruit the pilot farmers in as pilots from our database of 115, to how we selected, police checked people, reference checked, and went through the training. So all those are actually part of the risk management, that you're actually checking, doing the background checks, and then skilling people up for the issues that they're going for the practice that they're actually going to be delivering. But I suppose there were two other key areas of risk that arise, and the one major area was around the whole health and safety area and how safety was managed on each of the farms. And we did look at that. It's slightly different in terms of the legislation, but in terms of best practice on both sides of the border, we very much took a best practice approach, and were guided by the Health and Safety Executive in the north and the Health and Safety Authority in the south, in terms of the work they have done on farm safety. And we would have addressed that in terms of it really being the ownership and responsibility of the farmer for his own safety, health and welfare on the farm, for those of visitors or for people who are going to engage, be it as an open farm to the public, occasional visitors, or indeed as a social farm. So in other words, that it's about being able to look at your own farm, look at the activities, look at what changes during the year, look at the variables in terms of contractors coming in, seasonal changes in operation, what you have in terms of equipment and that, and how you go about your practice. We found in terms of doing that, we needed to bring in people as a fresh pair of eyes, to use that term that Vincent Coyle actually used this morning, more from the support delivery side of things, but from the farm safety side of things, we found that actually bringing in somebody to walk through the farm, people who have experience of doing this, and we use one of the farm relief services from Rossgray, who do this in the farming business, in their own business and in the agricultural sector, as contractors, to meet with each of the farmers, to walk the farms, to look at what the risks were, and to support farmers in actually becoming competent in doing their own risk assessment on an ongoing basis. So out of that risk assessment, farmers have come up with what needs to be done, guided again with the resource of the Farm Relief Services supporting them in identifying that. There is a small capital grant available through the project for farmers to actually address any areas that come up under health and safety. The other thing we asked farmers to do was they need to actually communicate this to people who are coming on board. In other words, communicate things that need to be communicated about how risk is managed on your farm. And we've looked at that in a number of ways. In fact, I suppose in our special needs services and that, we would have used a lot of symbols and photographs over the years to communicate to people and show them where an area, show them many things. In fact, photos and symbols are being used in the mainstream sectors of health and safety to communicate to people in all work settings where risks are and how you avoid them and that. So that's how we're actually evolving on that front. And the final piece we're doing on it is the actual safety statement, which is more of a policy statement around managing risk on the farm. The other key area of risk then came from, so that was the information that the farmer has. That's the farmer knowing his own business, his own farm, his holding, and actually how he's going to manage and plan and continue to manage risk on his farm. The other
Sorry, just hold.
Yeah, I was actually just moving to that very point, that the other bit of information that we actually didn't have was the specific information around the people who were going to come out, and we're going to come out and actually partake in activities on the farm. And that's the bit that we actually then need to marry into what the farmer is doing. So he knows about his farm, he knows how he's going to support, he knows how he's going to, what the risks are on his farm. The information that we don't have until we actually know the people who are coming out is the specific support information that we need to know about each of the individuals. And that's the bit that we're actually putting together with the services, because the person or their family, or the person, the family, and the service who supports them actually has that information. Risk assessment is done within organisations. Organisations know the areas that a person needs support in, be it somebody who has diabetes or epilepsy or a behavioural issue or a communications issue. And they're the things that we need to know. So that needs to come out into the workplace or into the experience place on the farm. And that's the bit that we're actually putting together in what we're calling a support framework, and we're calling it a framework because many services actually have quite a bit of this information done. So we're marrying those two bits. In other words, it's information from the farm, managed information from the farm, managed information around each of the individuals, and around that we're putting our support framework and support information in place to keep each person, the experience safe and positive for each person. That's the approach that we're adopting.
Paul, perhaps pass it over to Richard to say a few words.
Yes, certainly. I'm from Care Farming West Midlands in the UK, so we're kind of 4 years down the track, and we work with a network of about 66 active care farms in the West Midlands. And as a result, we see a wide range of venues, and we also see a wide range of client groups. And consequently, there are a wide range of risks. What we've sought to do is to support the care farming network with a framework that they can operate safely within. And we're occupying a position similar to Willamette, actually, in between the care farms and the commissioning agents. So they're looking for their risk assessments to be functional, for them to be able to assess the risks associated. And often it's a perceived risk as opposed to the real risk. Insurance is one of the questions that came up. And what we found in speaking to insurance brokers, because you almost have to start at the back and work to the front, because ultimately if it's about insurance and in the days that we live in, if it's about who's going to get sued, if that's what really what the question is, it'll be the insurance companies that will be wanting to know whether the appropriate steps have been taken along the way. So the foundations must be good communication and knowing what you're going to do. Who are your stakeholders? What are their requirements? What are they expecting you to do? Bringing people into an environment where often it may be that skills are learned through a family, it wouldn't necessarily have been documented. But in the arena that we're talking about, it's helpful to have your procedures clearly set out. I do take the point, you don't want a rule book, and you want to create freedom. That was mentioned earlier on. But actually, if you can create the boundaries and you can communicate your processes and your procedures clearly to all your staff, then if anybody asks the question, how did that happen, if you can demonstrate that you've done all that you reasonably should have done in the circumstances, then the liability should not sit with you. So working with stakeholders to understand what they're expecting, where their responsibility will cease, and when the handover takes place. Is it at the farm gate? Is it at a particular point in the journey if you're collecting people? Communication is absolutely key to identify what the risks are, and communicating them well to your staff and understanding who your staff are, who your volunteers are, and making sure that everybody that's on your team is communicating the same message.
Okay. I think, Roy, could I just add to that? Yeah. I think the issue of insurance was a common concern and question raised, and I know we're joined. Fintan Kennedy from FBD is with us, and Fintan has done a lot of work with the project around this insurance and liability question. So, Fintan, would you comment maybe where FBD sit on the insurance issue at the moment, please?
Thanks very much for inviting me here today. I've spoken in depth with Paul and with Dean, and like when we came to it first, it was something that everything was new. Underwriters by their nature are very cautious, but the background work that has been done, and as you said there, the foundations that are laid are so solid, and the work that's done in terms of the risk assessment in advance, both with the participants and the risk assessment on each of the farms, it has given us
Thanks,
Yeah,
Vincent.
thank you for that, yes. Just looking at the time, the panel will be available over the coffee when we finish at this, so there may be occasions to discuss further with Paul and so forth, and this whole area about risk and insurance. So I think I might move on to the next question, unless there's an immediate response. Right, next question. I think that has to be returned to.
Where the maybe additional premium would be in terms of having employers' liability, because participants aren't actually employees by law. They're deemed to be employees, that there's a payment in kind, and it's the same as if a neighbour came onto your farm, even though they're not paid. There's a payment in kind, so there would be a requirement for employers' liability.
Okay. Right, we'll move on to the next question. Payment to farmers in future from the public financing. Brian, Philip and Reid, perhaps, maybe on my right, we'll start with yourself.
Yes. Just so, like I already said in my presentation, we receive €40 a day, irrespective of the number of clients that we take care of. We can take care of maximum 3 clients. This subsidy will be paid by the government of agriculture and fishery, but there are some conditions to receive the subsidy. We have to make a contract with a recognized welfare organization. This organization must be recognized by the Flemish Welfare Department. And it is only meant for farmers when it is their main profession, when the clients are on the farm, I have to mark the presence of the client on a register, and this register must be sent to the government of agriculture, and they will pay us 4 times a year.
Okay.
So, I hope you understand.
Thank you.
Would you just comment from the perspective of UK?
Yes, well, I can really speak from our point of view, from an Acton Mill Care Farm point of view. It's funny, we've got a very similar number, 40. Our base price is £40 per day. And then we build up from that if you want additional services, if you want one-to-one support or extra support. £40 assumes you can be part of a small group, up to 5 or 6 people. It goes up if you need extra support. It goes up if you need transport or other services. So we build up a price. So that's how it's done. I think I said when I was talking, what we've endeavoured to do is to try and spread risk. Because this is like any other business. You don't want to be overly reliant on one source of income, so we try and get different sources of income. Now, how reliable those sources are is anyone's guess, I think, the future of public finance, and it looks like it's heading downwards, but sometimes that can have some surprising consequences, and I think I just touched on it when I was speaking. The fact that the local authority cuts its budget, I thought, would be detrimental, but in fact it turned out to be a positive for us, because they actually cut their own direct services, and people then came to us for services. So it is quite a difficult thing to predict. I think that we could do quite well. I think care homes and care farms could do quite well in the future.
I know there's somebody who wants to ask a question. Just wait from Brian, then we'll move the mic to yourself. Brian, if you want to.
I suppose from the context here in Ireland, particularly in the Republic, from our experience, there is change. As Philip pointed out, we are a number of years behind here in the change in individualised funding. No question about that. That change is coming. James Riley continually talks about it as in the money following the patient, and now he refers to it in the hospital settings. but he is also referring to it in the disability sector for sure, and I'm not so sure about the mental health services. With probation services, it's much easier because the cost per client can be easily established, as in, say, addiction services and those kind of services, because it's particularly interventions that can be costed and priced, and you can compare prices. With disability services, it's much more difficult to tease out the cost, so comparing and setting price can be different. So that change is happening in Ireland. This project, I suppose, is ahead of that curve, and how far ahead of that curve is very hard to say because of the whole reform issue and the cost cutting. The cost cutting may be an advantage in that that will happen quicker, because in many cases, when people are, when you cut a cost, you go for something that seems definitely to provide the same results and maybe perceived to be less costly. So it's very hard to know. In relation to payments to farmers, there are a variety of services who are already paying farmers. So that may be family, it may be charitable contributions, it can be the likes of lottery funds, it can be a variety, and what was referred to as a cocktail of funding sources. That provides challenges because somebody needs to know that landscape, know where to go and know how to access it. And I think that with all of the experience in Belgium and the UK, that kind of support agency, the networking is key in doing that. And so for innovators and first adopters of this kind of activity, that will be a key. So if somebody found something where they can get support or get funding to support clients and to support participants, and that moves along until there's real policy change, where in the Netherlands, for instance, the Department of Health and Department of Agriculture came together and agreed to make a payment to farmers. So I suppose that's really the comment to date on the situation. It is, we're ahead of the curve in some ways, and it's unknown to a point.
Okay, I know there was a question. Helen, if you can get the mic.
Well, if you said that you have 3 people residential care on the farm, and they have supported living.
The short answer is yes, yes.
And who provides support?
Well, we provide the support. They receive two types of allowance. One is directly paid to the care farm by the local authority, and another allowance goes to the client themselves, and they can choose how to spend that. So
do you have the expertise to look after people with learning disabilities on a full-time basis?
Pardon?
Do you have the expertise to look after people with learning disabilities on a full-time basis?
I think it goes back to what I said earlier. I don't think it requires people with high-level medical training to do the looking after. What we need to know is, what to do in certain circumstances and when to approach them to go to the doctor. And I think we've pitched it about right. I think there's a danger also from care farming point of view that if you start to employ people with medical expertise, then your costs are going to go sky high. I mean, you've got to bear that in mind, that staff costs are could be a significant factor.
Okay. One more question. Eben here, please.
Just to clarify what Phil was talking about in care farm was a wee bit far out. We were talking about family farm. He's moving into a sort of role of care farm is the primary income of the business, and he provides care. He's got 200 acres and he wants to sort of, if it gets much bigger, he wants a corporate thing. I think somebody said something else was told me maybe get backwater. But the Flanders model goes along the family farm idea, and I'd like to know where do people think we should go, or something in between, or what's the ideal model?
Leads us to the third question, perhaps. Future, what next to the project? So maybe we'll try to tie that in with the response from Jim and Nadine, because I think it's a...
Oh, sorry, we could address it now.
That's what I'm saying. So it's an important link point.
Yeah, I suppose there are different models emerging in how you do it, and even the terms, we don't make very strong distinctions between them, and perhaps there aren't strong distinctions as yet, but I think it will become more so as time goes on. There's a range of services being offered, and I think Philip would have talked about the measure of the success being how the person who uses the service experiences it. The model that Philip is talking about is different than what we are doing in this project. But if people are having a good experience from that, I think that's fair enough.
And if it essentially remains a farm, that's the thing. A farm of 200 acres, a farm of 2 acres, if it essentially remains a farm, I think... well, in many cases on farms in Leitrim that I know of, the primary income is... yes.
Yeah.
If it's essentially a farm and people are getting that experience of the farm, I'm not sure that it really... And this discussion took place when care farmers, social farmers get together to define exactly what you're talking about. Is a city and community garden, for instance, where people experience horticulture activity similar to a farm, is that considered a care or social farm setting? The debate is quite endless, and there is a continuum. We're quite focused here on the family farm because of the nature of farming in Ireland, but there is certainly a continuum on that scale from the family farm to larger commercial activities, garden centres. I mean, in Europe, the continuum is huge, up to large institutional community farms in Germany, which were set up after the war to avoid the issues that arose during the Third Reich, for instance. So there is a continuum.
Sorry, maybe I think Richard can add a bit to this discussion as well.
Yeah, I think one of the really interesting things about this pilot is the choice of the family farm. And from the experience of what we see in the West Midlands, that's going to contribute some very positive components to the experience of people. What we have seen across the wider client groups, working with people with drug and alcohol issues, ex-offending backgrounds, combat stress, those kind of things, sometimes the group dynamic is a positive contributor to that. So it's about the choice of the venue, and the diversity of provision is something that's attractive. It makes it slightly more difficult to communicate to a commissioner, but I think the results of a family farm and what is modelled in that setting is a very positive factor, which evidence from this pilot hopefully will underpin.
Just to finish, the only thing I would say is, I as a small family farmer can't compete with somebody who's on the scale of Philip, and he comes into the area and what's going on in Flanders or whatever, you won't be able to compete with the sort of services he can provide, because he just buys animals for the feeding, touching contact. And whereas we have it's totally different. And he's also working in a market context, whereas he goes out to sell services. It becomes another big corporate care farm 5 miles down the road, and they say they'll do it for 30 and 30, it's economy of scale. Where does the whole concept go? I'm not going to say...
No, if I can just say, I mean, our core business on the farm, the business, the main business now is caring for people rather than caring for animals. You're perfectly right. But I said someone used the word continuum. I think there's scope for all sorts of arrangements. You know, whether that's one person coming in a couple of days a week or whatever. I think that can work. I think they can all work alongside each other. I think it all boils down to, what do you want? What's your business plan? Is your business plan to run a farm and you can make do with sort of a couple of people coming in? Or as in the case that I faced, this farm was going to be sold off. This lady was going to lose the farm. You know, what do we do in those circumstances? There was no way that raising some more sheep was going to solve that. So, it's going to be different situations in different places.
You wouldn't have been eligible in Flanders because you're not a farm. Yeah.
Maybe Jim, can you pick up now?
Yeah, thanks, Roy. I think we've starting to touch on the question about the future. We're able to, in some ways, be clear on what this project is about, who it's working with, what it's going to do, up to September 2014. The question was, beyond that, what next? And I suppose in response to that is that when we embarked on this project, because of the nature of the unknowns that were within the project, how much interest, how much commitment, pilot farms, learning lessons, the uncertainty, it was not possible to start scripting a phase 2 of the project. But there is little doubt amongst the partners involved in this project, that is Queen's University, Belfast, Leitrim Development Company and ourselves in UCD, that there is a real value in we now looking at what next, what might a phase 2 look like. And I suppose without setting out what a second phase would look like, it's not a case of doing the same again. It would be a case of saying, if we have been instrumental in bringing social farming to a level with evidenced pilot farms, with training completed, with greater awareness, greater understanding, and we have convinced, hopefully, enough people who are setting public policy in the health and agriculture rural development sector, the question about what next is very clear to us, that when in this project we have been and are the drivers of this initiative, we would be saying that phase 2, we take a backseat to support the drivers of the initiative. And that in many ways is yourselves. And we would be looking to the network which is established, and some of you are very familiar with it, to be in many ways the driver of the future of social farming in the region, maybe on the island and a wider sphere. So, what next is that we are certainly open to a phase 2. A phase 2 would have a very different role for us as partners. We would look much more at supporting the network and training and that softer side of things, supporting those interested and being very much the advocates for those interested to in many ways address some of the questions about how do we get support into this sector, how do we get support particularly onto farms for the new services. I've mentioned the network, and we from the outset were very clear that the network plays a central role in social farming, its future, that the network is always about bringing together the provider agencies, farmers, a whole range of those who are interested, including local development companies, public agencies, and starting the discussion. I think Tony Bates talked about the importance of discussion and dialogue. Well, that was particularly the role of the network, to get that discussion going, and discussion by people like yourselves who get it, who understand it, who are committed to it. I don't know what can evolve from that, but certainly the discussion can throw up some solutions, and our role would be in a phase 2 to support those solutions. I think the project, what I can be definite about, what we are going to try and do, is we're going to really try to convince the public agencies in particular, who will be at the heart of supporting this long term, to use this project, to use the lessons of the project, particularly the lessons from the pilot, to provide the evidence and provide, in many ways, the stories which will convince them to take a greater involvement and to seriously look how they can play their role in supporting it. So right across the spectrum, from the health and agriculture agencies to indeed farmer organisations and local development companies. They all have a role in building a future for this. So we don't have a blueprint. We have a commitment from our side that we can seriously look at a phase 2, but the phase 2 will look quite different from what we have been working on in this part of the project.
Okay. We'll move on to another common question, and maybe if I could ask the respondents concise and quickly. Aideen and Jim, what plans are there in place for training?
I think obviously these questions were requested before we had the presentation, so I think we discussed this pretty well in terms of what the plans are around training and what is happening in the pilots. Paul outlined the nature of the training that has taken place so far with the pilot farms, and there are a few more days to be built in as part of that as we go along. What we're going to do then, as I outlined this morning, is we will be evaluating that training, talking to the farmers themselves and the services that are involved in terms of, are there gaps there? Were there areas that needed more attention? I say maybe the gaps haven't been addressed at all, and evaluate that training. And based on that discussion and evaluation, in association with the network, we will be designing training. There will be 2 training programmes ran, both for a mix of service providers and farmers, based on the inputs of the pilot and the network. And those are our plans in terms of training.
Anything? Okay. Happy enough? Networking, I think this is a question, Paul, you can pick up. Plans for membership organisation, role of health and rural agricultural organisations in the network. Again, if we can succinctly. Okay.
Well, I'll quickly, because I think Jim did a pretty good job there of kind of answering that in terms of the central role that the network is intended to play and to evolve through this project, and then to be something which is going to sustain on into the future. Yeah, certainly the whole area of the rural development and the agricultural organisations, they've a key bit to actually play in this. I mean, some of the key players that we have at the moment are the pilot farmers and those farm families who are interested, the wider set of farm families who are there, and the health and social care organisations, statutory and voluntary. But we do very much need the whole rural development, the expertise that I think Brian shared there this morning that's in the development companies, and indeed the agricultural training organisations like Chagas Kandard up the north to contribute and to work with us on this as we evolve training and evolve to be part of that discussion in the network. The other key people that we really need to bring on board a very central way in it are the people actually themselves who use the services. In other words, I think, as it's been already said, if it's going to be sustainable, it will be because people continue to want to use and to link in with farm families to walk through that farm gate and to be part of that. So people themselves, in particular their representative organisations on both sides of the border, we'll need to, we are in touch with, and we know, and we need to kind of get them in a bit more cemented into the actual conversations that we're having in terms of shaping the network.
Okay, thank you. Any questions? There's one here. Helen, if you could get the mic. Yes, thank you for that. Yes. Okay, and I press the right button. This question came up quite a bit. Outside the SoFAB region, which has already been described, how do people get involved? And I think, Aideen, could you pick this one up?
Just to respond to that last question or comment, yeah. No, I suppose the project itself has focused on 2 areas, mental health and intellectual disability, purely for practical reasons in the implementation of the project. The project is quite a bit smaller in a way than what was originally applied for to the Interreg programme. And so the practicalities of getting useful information from the research element, which is an important element of this programme, meant that we had to focus. And that focus meant working with particular groups. But on social farms in general, I think there is a mix of people in smaller numbers at any particular time. And the whole idea is that it is and remains a working farm and not an institution. So when Philip talked about recruiting clinical staff, you move into a different arena. And people require support to an extent. And when they are accessing service on a farm, it certainly is not recreating those institutional settings. as far as we can see in what we're trying to do here. And the focus in this project in particular is the family farm. There is a continuum, as we discussed earlier, so we're aware of that possibility, but definitely not interested in hiring clinical staff on farms.
And I suppose, too, maybe just to add to that, in terms of the emphasis of the project as well, it's very much around responding to what people want, what people who are using services want. And I think if we, and I know a lot of services are moving in this direction, in terms of trying to change how they deliver their services. I think if we keep working together towards responding to the requirements of people and not approach it as an institutional service that we fit people into, I think is our best way of guarding against that happening.
If I could just say something, just on a positive, really. I mentioned earlier that we take children who are in danger of being excluded or have been excluded from school. And in our experience, they work really well with people with learning disabilities. And so you get this mix, and you get children who are, for want of a better word, real tearaways, being really helpful to people with disabilities, and it's really good to see. And I think that's sort of just counter to perhaps forming some sort of ghetto. It's actually creating some understanding.
Will we? Aidan, do you want to say then, regards this specific question just popped up?
Sure. In terms of people, there was a question around asking about if you're outside the SoFAB region, how you get involved. Just to say, I can't remember if we said it this morning, but this project had intended to be a much broader and bigger project, but we have to follow where the resources were available, and they were in the northern half of the country. The work of the SoFAB project was always envisaged to be available to a much broader, it was to be available for the island of Ireland, and we've encouraged people to get in touch with us and to link in with the project across the island. And there are a lot of people here in attendance today from Cork and Kerry and upwards, and we're delighted to see that participation in the event. So we're very keen that people will stay involved with us, and we will keep involved with them and inform them in terms of what's happening and in terms of all the outputs that are coming out of the projects, and as we progress towards future planning. Just to maybe add as well, we mentioned the Community of Practice this morning. The Community of Practice is a voluntary group that has very little resources but a lot of goodwill and intent, and this project has effectively come out of the Community of Practice group. But that group has recently made the decision to move towards forming a national association on social farming that we will be setting up with a view as a membership organisation for people that are interested in social farming. So there are plans afoot in that regard on a national basis to create and respond to the demand that's there, actually, to create a social farming association. So that will be the next step in that regard that will be open to people to participate in.
Just a second, we'll get a mic for you.
Which one? Aibeen's coming to the microphone to you there.
So everybody can hear.
Can one liaise with leader anywhere in the country if you want to bring a project forward?
Sure.
The leader project.
Yes.
Leaders throughout the whole country.
Yep.
Yep.
Okay, and say for instance I want to do the social farming, and I'm told, okay, wheelchair access and all those things, I need to give you footpaths and those
Yep.
other things. Therefore, I approach leader with this in mind.
Yes.
Social farming, these footpaths, etc., etc. So that is available throughout the country.
It is, yeah.
So you can take that project to any leader.
You can, yeah.
And bring this project forward to them.
I suppose there is experience in Leader, but there is a current project from Monaghan with the Department of Environment in relation to social farming activity. The Leader, you may or may not know much about the complications of the programme. You'll need your business plan, you'll need tax clearance, you'll need your quotations, etc. It's a farm diversification project, which I said earlier is eminently eligible because you're using the assets of the farm in a non-agricultural activity. So it's social farming development and capital investment on a farm is eligible under that measure. The current programme is obviously coming to an end, so there are issues there. But there can be issues of misunderstanding in the department, I know, and the same has arisen, I know, with John Farr may talk to you afterwards if you talk to him about it. He's actually sits on a LAG board in Northern Ireland. He also applied, I think, to another LAG nearby, and there has been some issues there as well. The answer is yes, it is fundable under the Leader Diversification Measure or Business Creation and Development Measure, but you have to go through the processes there. It's coming towards the end of the current programme. I would hope the next programme that social farming will be written into it much broader around the country, so that if you're in an area where there is the plan for the next programme being developed, engage in that process and ensure that social farming is written in as part of the strategy with your local leader company. And that will help ease your path if you go to them for funding.
I've been to Leader before for the business project through Denver again market project, but this is a project that can be taken back to Leader, and they were looking at taking the statements on the weed area, okay? Yeah. So now is the time, because that funding, previous funding has run out in 2013.
Yes.
It's finishing up this year. So going forward to the next project, the number of people having been here today couldn't approach the Leader and put it to them that social farming is something that we should be looking at and be.
Absolutely. Absolutely. I would say that's a very good thing to do, is to approach your leader company, and if they want the information within the public domain and even within professionals and people in the leader companies they may not have the information that we've discussed here today, they may not be aware, but that information is building up here and we can certainly share it with any leader company. And I've been talking to my colleagues on a regular basis about, and there are other leader companies here today. So yes, it is a leader project, yep. Yep.
No, it was part actually of the idea behind this project was we've been working with leader companies individually for years trying to promote the area of social farming, but it's very difficult for an individual leader company to invest time and resources and time staff in trying to work out how to develop social farming. So part of the rationale of this project was to work out those details and be able to present the information so that people like yourselves might be going in promoting a project, or the leader company themselves will have that information to work from and give them a good basis. So the intention was always to complement the leader programme.
Okay. Right, those are the 6 themed questions that a lot of people had noted on the feedback. What we have now are specifics. We've called them the practicalities. These were things that didn't fall into any of those previous 6 broad areas. So you can see them listed there: number of people per farm, number of days per week transporting, client groups, what others can be considered, referral criteria for clients, what should be in a service plan, and permission slips for photographs. Now, what I'm going to do is pass this over to Paul, and I think he'll take you through each one as quickly as possible and to give some feedback on each of these. Okay?
Okay, and just answering these in respect, I think they were posed in respect of the SoFAB project, so I'll answer them in respect of the SoFAB project, but I can elaborate afterwards if people want a little more information. Number of people per farm on our project is there are 3 opportunities being offered on each farm. The number of days per week, we are offering 30 days, or the farmers rather are offering 30 days of experience during the piloting phase. Now that can be a day a week, and some farms that might be 2 days a week. But it's roughly a day a week, or 30 days of experience during the piloting. Transporting for people out to farms, we are looking at whatever arrangement can really work for the people. We asked, in terms of engaging people with this, we've asked people to engage by choice. So people actually want to have a look at this option, want to explore it, and want to engage. On the form, the potential participant form, we actually asked who else in your life and in your family might support you with this. You have a brother, sister, parent, neighbour, somebody who can actually help with some of the practicalities. Can the service that you attend at the moment, can they help? Do you travel independent? Can we support you in some way? So we're actually looking at, and transport and the logistic of transport I think will always be there around connecting people out into more diverse places in the community, both urban and indeed rural. So we're actually trying to come up on an individual basis. How do you support some? We don't want to be putting in crutches that people don't need, and we don't want to be putting it onto the farmers to actually become part of the transport system. In some circumstances, we might, for the last mile or two to the house, if people can get a lift to a local village or a bus to a local village, that the farmer might do the last leg of the journey. But that's what we're doing. We'll obviously have more detailed information on that at the end of the piloting, just exactly what did happen with each person. What other client groups? Well, basically anybody in terms of social farming, anybody who uses health and social care services as a support and wants to make a choice in terms of where they want to go in their life, in terms of how those services are supporting them. Anybody, any of those groups, that could include elderly people, people with Alzheimer's, people going through drug or alcohol rehabilitation, people with acquired brain injury. So it's actually anybody, and again, being guided by the choice or an option that a person wants to pick up, and the supports or the farm responding to that particular choice. The referral, just the other point to briefly mention on that is the point that the question that was raised about how do you prevent something becoming an institution. And I suppose even before the congregate settings report was out and the new directions on day services, social farming was talking about being a local response to local choice. Tony Bates spoke this morning about connecting people back into real lives, real opportunities away from institutional models. So certainly the whole values and vision that underpin what we're talking about here on the project at this stage are certainly very much about local, individualised, small settings connecting in with family farms. So referral criteria for people at the moment for the project, there are two groups of people that we're offering the opportunity to: adults with a learning disability, adults recovering through mental ill health, and that they are connected to a service provider. So they'd be the three criteria that are actually there. What should be in a service plan? Well, we don't actually have a service plan per se. We have a memo of understanding that is shared between all the current people who have signed up to the project, the statutory, voluntary members, the social farmers, the participants in the SoFAB project, and that's probably a bit unique because it's around a project rather than getting it into an ongoing relationship. But basically a service plan details what the social farmer is going to provide and what the expectation of the person who's providing the funding to do that has. So there's a quantum of service for an actual budget against that. That's the theory of it. We haven't got to that stage yet, but that's the general theory of how service plans work. Photographs and permission within the project. Again, it's in our memo of understandings that whatever local policies and procedures that a local service agency would have around permission slips or other policies and procedures, that they would be applicable for the social farmer in their area. In other words, our social farmers are working the very same as if somebody was going out to get their work experience or their engagement with the local library or the local shop or a local delivery service or a local garden centre. So again, the policies and procedures of the organisation would cover that, what the permission is in terms of using photographs of people in that situation. So that's what we built in as how it will operate in terms of the project.
Okay, thank you, Paul. I know we're getting close to our time, but I notice a hand up at the back, so perhaps one more question before we...
Just very quickly, do they have to be in receipt of the healthcare service? Or can people from the community who are interested mix in and join in?
No, at this stage we've actually described it because we want to kind of capture the relationship that there is there. We're not taking people who are self-referring into the project. So we are looking for people who are linked at this stage and are receiving some degree of support from a health or social care service. In the future, there are many things that are going to be possible. Let's say absolutely. I mean, the future in England is that people actually have their own budget and that. So obviously, that will be part of the picture going into the future, but not within the project.
And I would say any of the pilot social farms that are out there now would willingly accept people to come and make arrangements with them as they stand.
So thank you all very, very much for today's efforts.